Welcome to this explainer. If you're tuning in, chances are you or someone you love has just made it through head and neck surgery. So, first things first, I want you to take a nice deep breath. You're in safe hands, and honestly, the hardest part is already behind you. Today, we're going to walk through your recovery process step by step together. My goal here is to be a partner in your healing journey, giving you clear, structured guidance straight from your post-operative instructions. We're going to take all the guesswork completely out of the equation, so your only job is just to focus on resting and recovering. Okay. Let's dive into this. We'll be looking at 5 very predictable phases of your recovery: immediate post-op and bleeding, your daily wound care routine, important activity restrictions, managing pain and medications, and finally, the warning signs to watch for. Section 1. Immediate post-op and bleeding. Understanding the first 48 hours. Bleeding is completely normal and to be expected for the first 24 to 48 hours after surgery. I really want to emphasize this right out of the gate because, understandably, seeing blood can cause a little panic. But please know your bandage might actually become completely saturated, and it could even leak a bit of blood during this window. This is entirely normal. It's an expectation, definitely not an emergency. Now, if your bandage does get completely saturated to the point where it's clearly not absorbing any more blood, you actually want to remove it. When you leave the office, you're wearing this bulky white dressing made of gauze and tape. It isn't strictly medically necessary for healing. It's really just there to contain the initial bleeding and make things easier for you. But once it's completely soaked through, it just can't do its job anymore. So go ahead and gently take it off before we move on to the actual technique for stopping the bleeding. All right, so once that bulky bandage is off, it's time to apply pressure. You'll want to follow this exactly. Take some gauze, a clean paper towel, or even a washcloth, and place it directly onto the surgical site. Press down firmly, and here's the absolute most important part. You have to hold continuous pressure for a full 30 minutes without lifting it. No peeking. Peeking releases that pressure and breaks the delicate clot your body is working so hard to form. So just set a timer on your phone, sit back, relax, and hold it steady. During these first 48 hours, swelling and bruising are also highly expected. You might even notice the bruising start to travel down towards your forehead or your eyes, which, again, is completely normal. To help minimize that discomfort, keep your head raised up using a few extra pillows, or you can even sleep in a recliner. Just make sure you don't sleep on the side of your body where the incision is. You can also apply ice around the area to soothe the swelling, like near your eyes, for example. Just be sure not to place the ice directly on top of the incision itself for those first 48 hours. Section 2, Daily Wound Care Routine. Steps for safe and optimal healing. The most crucial thing here is knowing exactly when to actually start your cleaning routine. Remember that bulky white bandage we talked about? Well, underneath it, your medical team placed a clear, waterproof bandage with a little white pad directly over your stitches. It's perfectly normal to see some blood trapped under there. Your daily washing routine begins only once this clear bandage falls off on its own, which is usually around day 1 or 2. If it is still stubbornly sticking around by day 6, you can go ahead and gently peel it off. But until then, just leave that clear bandage completely alone. Let's move to and see how this builds. Once that clear bandage is off, you'll want to perform these 4 gentle steps every single day until your stitches dissolve or are removed by your doctor. First, always wash your hands thoroughly. We want to keep everything nice and clean to prevent infection. Second, gently wash the incision itself with mild soap and water. Third, apply a generous amount of Vaseline to keep the area properly moist. And finally, just cover it up with any clean bandage you happen to have at home. It's a very simple, very soothing daily routine. Now, I want to highlight a very specific timeline for your skincare, as this is absolutely crucial. For 1 full month, that's the first 30 days, your only topical treatment should be that direct daily application of Vaseline. Keeping the wound moist with Vaseline is absolutely critical for early healing. Only after you cross that 30-day, 1-month mark should you begin applying any other products to the area, things like sunscreen, makeup, or scar reduction products like Silogen. Section 3. Important activity restrictions. Protecting your repair. For at least the first 2 weeks, we need you to modify your physical movements. Light walking is generally fine and actually encouraged to keep your circulation healthy, but you absolutely need to avoid heavy lifting, heavy cardio, bending over, or any kind of strenuous activity. Heavy lifting early on can trigger sudden bleeding, and it can actually worsen scar widening at any point during those crucial first 3 months of your recovery. A really good rule of thumb while you're healing is to avoid anything that raises your blood pressure, stretches the repair site, causes you to sweat, or puts any sort of direct tension on the wound. Protecting that incision from physical stress ensures the stitches hold perfectly and keeps the resulting scar as minimal as possible. Section 4. Managing pain and medications. Staying comfortable at home. When it comes to pain relief, over-the-counter medications are highly effective if you use them correctly. You can take 2 extra-strength Tylenol, which is acetaminophen, and 1 to 2 Advil or Motrin, which is ibuprofen. And actually, unless you have a specific medical condition that prevents it, you can take these together every 6 hours. This combination works wonderfully to keep both your inflammation and your discomfort at a really manageable level. You'll also want to immediately resume all of your usual medications, whether they're over-the-counter or prescription. If you had to pause anything before your surgery, it's safe to restart it now. And if your nurse prescribed an antibiotic, please make sure you take it exactly as directed, and always take it with food. That simple little step goes a long way in preventing an upset stomach. Of course, if you do have any kind of reaction to the antibiotic, just stop taking it and give the office a call. Section 5. Warning signs to watch. Knowing when to call the office. The main complication we associate with early bleeding is called a hematoma. This simply means that blood is collecting underneath the skin rather than draining out. Because it's pooling beneath the surface, it creates pressure, and there are some very specific visual symptoms you can keep an eye out for. And this brilliantly illustrates the difference, because it is vital to distinguish between a hematoma and an infection. A hematoma usually presents early on as a rapidly expanding, firm, tense, and painful lump. You might notice a dark purple mass, experience severe and increasing pain, or suddenly have trouble with your vision, breathing, or swallowing. If you see any of this, you need to call the office immediately. On the flip side, an infection typically takes a little more time to develop, most often showing up between days 3 and 7. Signs of an infection include a fever over 104 degrees, chills, spreading redness and warmth, thick yellow or green drainage, or a pain that suddenly gets much worse after it was initially getting better. Now, if you happen to notice some strong itching paired with bright redness right around the tape itself, please don't panic. This usually just means your skin is a bit sensitive or allergic to the bandage adhesive. If that happens, simply take the bandage off to remove the irritant and call the office. They'll give you further instructions on how to comfortably cover your wound. Earlier, we talked about holding firm pressure for 30 minutes to stop any bleeding. But what if the bleeding simply will not stop after several back-to-back 30-minute attempts? If you've faithfully held that continuous pressure without peaking multiple times, and the wound continues to actively bleed, that is your cue. Don't wait around. Call the office right away so they can assist you. I really hope having these steps laid out clearly gives you some much-needed peace of mind. Remember, your medical team is always just a quick phone call away. You are absolutely not doing this alone. Your only job right now is just to rest, follow these simple routines, and let your amazing body do what it does best, and heal. Thank you so much for joining me for this explainer. As you head into your recovery, I want to leave you with one thought. What is the single most comforting thing you can do for yourself today to make your environment perfectly suited for healing?